I'm 50 years old. I feel healthier now than I did in my 20s or my 30s. But as I got older, I think everyone feels a physiological change in their libido. The responsiveness, the sensitivity, the youth.
We're very intimate, we're very touchy, we're very affectionate. In the bedroom, it's been wonderful.
My sex life was fine, but I wanted better performance.
He had been taking ED medication, and I did not know that he was.
This is just such a taboo topic, though, to talk about. I didn't want her to think that we had any issue with our love life. We didn't.
I think when you're in a spontaneous moment and they haven't taken it, and the performance isn't as it was, I think you kind of internalize it like, he's not attracted to me anymore, or, you know, what's the matter with me? Am I not attractive?
I realized that the effects of that medication, you know that you've taken a drug, and it doesn't feel natural. And that's when I talked to Dr. Savage about it, and rather than turn to pharmaceuticals, to try the GAINSWave program.
Erectile dysfunction is very common in 30, 40, 50, and 60-year-olds. GAINSWave is a new therapy that's been added into the arsenal of erectile dysfunction therapy. Jason is an excellent candidate.
I had a series of 6 treatments. Today I'm here for a booster treatment.
GAINSWave uses low acoustic sound waves that vibrate into the penis, which stimulate tissue growth and stimulates the growth of more red blood cells, increasing the blood flow to the penis. Turning on the machine.
Just like going to the gym and training a muscle. You want a big tricep. It's the equivalent of a bench press.
Jason joins us with his wife, Gina, along with his physician, Dr. Paul Savage, and urologist. And look, this show that we're talking about is the embarrassing show. No man wants to admit that as, you know, you get a little bit older, sometimes things like this can occur. I understand your last treatment was just a few days ago.
Correct.
Have you tested the results?
I've tested the results. I've been testing them ever since.
So, all right. So have you noticed a difference since the procedures?
Yes, I've noticed that I'm more responsive, it's more sensitive, the orgasms are more intense.
Just a comment, just a little comment.
It's all the things that you would want to experience when you're having intimacy without having to take the pharmaceutical to get there.
Have you noticed a change in him?
Yes, absolutely. I think Jason's confidence has definitely gone up. Also, spontaneity has been more intense, too. And I think when you're able to talk about these things together, it makes for greater intimacy, too.
Better communication. Yeah. We've become more intimate. There's nothing hidden. You're not hiding any little pills. You're not saying, oh, we're going to have a nice night. Excuse me for 1 minute.